Power 94 WJTT, this is Big Tula, and this is May. Although it's at the end of it, it is still Mental Health Awareness Month, so we wanted to let you know about some of the resources that are available out there in our community, and one of those is the McNabb Center. So today I have Jasmine Ray, the director of Greater Chattanooga McNabb Center with us. How you doing today?
I'm doing wonderful. Thank you so much for reaching out. Yes, it is the end of May, but Mental Health Month is lifelong, it's always, and the McNabb Center served over 51,000 people last year. So this is a great conversation for us to have to be able to get some resources inside of the community.
So over the years, I worked with you all in some capacity with some of the positions I've had at different agencies, and I've always been impressed by the service that you all provide. So I wanted to give you a chance to talk to the community about the services y'all provide. So, and then we could talk a little bit about the populations that you serve, and then how we can go about getting people the services you provide. So could you start off with just an overview, an umbrella view of what all McNabb Center has to offer our community?
Of course. So the McNabb Center, I'm just going to focus down here in Chattanooga since that's where we are, but we do serve the entire Eastern Reach. So all the way up to Sevierville and those counties up there as well. But here in the Chattanooga region, we service Bradley, McMinn, Polk, Meigs, Monroe. So all of those are umbrellaed up under the services for Greater Chattanooga. I like to say we serve, from age to 3 to end of life care. So we have a therapeutic preschool where we take our young, our littles who have experienced any kind of trauma and need to work on those inside of a more school setting. And then we also serve adults. So we have 3 clinics inside of this region. We have a children and youth clinic. We have our adult center. And then we also have a McMinn clinic that services both children and youth. One of the things that's really unique about the McNabb Center is the accessibility. So we have what we like to call open access. And during the open access, you can just come in off the street. You don't have to have an appointment because sometimes that can honestly be overwhelming for people. On Monday and Fridays, you can come in from 1 to 2:30. On Tuesdays and Thursdays, you can come in from 8 to 9:30. And you can come in during those times, get an intake, get an assessment, figure out what's going on, speak to someone, and figure out what services you could potentially, benefit from having. We're outpatient mental health services, so we do medication, we do therapy, we do case management, we do health link, and then we have some specialty programs as well.
Oh, that's amazing. So you said from babies all the way up, and then you have the open access where whatever kind of services they think they need, they can come do an intake. And again, that's Monday and Fridays, 1 to 2:30, and then Tuesdays and Thursdays, 8 to 9:30.
Yes, correct. Yep. And we usually take them as young as around 3 to end of life care. Yep.
Okay, that's amazing.
We have some specialty services that can support those young children, like PCIT, which is a parent-child interactive therapy. We have therapists who are trained to be able to work with younger populations.
So here in our community, what do you see as one of the biggest needs that our community might not be aware that you all offer or can help with?
So I think one of the bigger things that I have noticed is that accessibility piece, which is, why I wanted to really highlight that we are here. You can just walk in off the street and be able to get served. But then some of our specialty programs, so we have a MAT program, which is the medicated assisted treatment. And it is not, like your typical just clinic, where you just kind of walk in and you get your substance medication and then that's it. No, this is a wraparound program with case management. This is a prescriber sitting down, kind of talking to you about the substance history, being able to support you as well as having some therapy. So our MAT services is one of the things that I think the community can really benefit from. As you know, we are in an opioid epidemic, which all of us are trying to band together to be able to support as many people as possible. So we do have that clinic at our adult center. And then one of my long-term favorites is our On Track program. It is a first episode psychosis initiative. It is geared towards young people, ages 15 to 30, who are experiencing psychosis or experiencing their first mental health break. That is such a pivotal age, where so many things start to come up. You are aging kind of out of high school, or you're just getting into high school, and that can be difficult. You're headed off to college and just kind of unsure. And so inside of that program, it's a wraparound program. We work with a lot of different organizations with children who are aging out of foster care or who are kind of transitioning from their home to college life. And they have wraparound services. So they have on-site therapists, they have case management, development. They get employment and education specialists, so someone that helps them walk through assigning their classes, getting a job, helping them know how to interview for a job, as well as a nurse that keeps up with their physical health as well as their mental health, and a peer support, someone who has lived experience either on the mental health side or on the substance side, and who can kind of walk that journey with them. So those are some of the specialized programs. I think the therapeutic preschool is also something that this city could definitely benefit. We are the only one like this inside of Chattanooga where, your child can come to the therapeutic preschool 3 days a week to receive specialized care to be able to address some of the trauma that has perhaps happened, address some of those behaviors that are happening because of the trauma. It gives an opportunity for the parents to be able to work closely with a clinician and someone who specializes in this to be able to get them ready to go back to their full-time school. We work closely with various daycares. We work closely with various preschools to be able to support this population. So I would say those are probably my 3 highlights of what our community really could benefit from and maybe not know about. We have tons of other programs inside of the Chattanooga region, though. I mean, we have like 36 programs down here in Chattanooga. So I honestly think if you walk in the door and you're needing something, we can meet the need.
If they want to know more about these services and other services you provide, how can they get that information?
The McNabb Center has a phone number, 423-266-6751. You can call that number and you will be directly connected to someone local here in Chattanooga. We also have our website. Go to the website to see, the services that we offer. But we're also on social media. And I know a lot of people are on social media now. So if going to McNabbCenter.org is not, what's going to work, reach out to us on Facebook. We're the McNabb Center, Greater Chattanooga area on Facebook, on Instagram, we're the McNabb Center.
And all these services that you mentioned, I think that the listener needs to understand are either you know somebody, you might be experiencing some of these issues yourself, or you know somebody that is. When it comes to mental health, it's always best to address. It's not something that's just going to go away. A lot of times, when we have ailments, we're like, oh, well, it'll get better. I'm just going to wait this out. This is not the time to wait anything out. This is the time, the quicker you get the support and the services you need, the better the outcome, correct?
Correct. I think that is so important. Reaching out for help should never come with any kind of shame. We take our physical health serious. It is the same as if you had any kind of physical ailment, diabetes, heart conditions, whatever. You're not going to ignore those things. So don't ignore your mind. Ultimately, this is how we function. If you are suffering in silence, it does limit your functionality.
Yes.
We're here to serve. We're here to help.
And also for those family and friends of people that you might know that are experiencing these things and you want support and you're trying to figure out how to help them. I know that I personally have referred clients to you all, and the support and the services y'all provide really helped because I didn't know what to do. And then once this was all in place, everything is just like falling together. Everything's gotten better. Being able to talk to somebody to help them with a job, being able to talk with the doctor when you have a question about, oh, we're at the PCP and they want to prescribe this, can he take this with that? So it's just the availability and it's just the like you said, it's a wraparound. So there's somebody there helping with every aspect, and then you partner very well with other agencies. So I just want to make sure the community really understands that they really have a good service here if they just reach out to the McNabb Center. And again, that phone number 423-266-6751. They can also go to the McNabbCenter.org or Facebook, the Greater Chattanooga area McNabb Center. I appreciate you for taking the time to tell us about some of the programs. Is there anything else you want to make sure that our listeners know about your all services?
No, Tula, absolutely. This was wonderful. I thank you so much for the opportunity to highlight this. I hope that the community reaches out and that we can support even more people. I would love to double that 51,000.
Okay, we thank you so much for the work that you do in our community. And again, this is Jasmine Ray, Director of Greater Chattanooga McNabb Center. Thank you so much for talking with us today, letting our audience and the city know about the services you provide. Thank you.
Thank you.